hi everyone. If you've just tuned in, this is Aliyah, and thank you for joining us. We'll go live in 5 minutes. As I see, I'm very glad to see Dr. Amer already smiling, and I'm also glad to see all the way, from UK, we have Dr. Ganesh having his morning coffee, I'm assuming. Since you've got to go to work soon. So we'll wait for a few more people. To those who have just joined in, let me run a few announcements by you. Kindly, you can leave your video on so that we can, actually see you. We're fine with that. But if you could turn or mute your voice, mute your mic, that will be helpful so that we don't have any background sounds or your phone ringing. It's glad to see quite a few names and friends who have joined us at 3 o'clock. And we've been getting a lot of questions. Actually, we have heaps of questions that have been forwarded. I will tell you, and I will repeat this again much later, we are not addressing whether you should take the vaccine. Okay? Nope, not doing that, guys. All right, both our speakers are not going to tell you, yes, you need to take the vaccine, or no, you don't need to take the vaccine. And if you need to take the vaccine, how long you live, I don't know. I'm very sure they're not going to tell you that either. Okay, so looking at their backgrounds, we have, gathered some questions. I've actually sent them some questions, and then I realized that a lot more questions came in. So I didn't want to, I'm sure they are pros at this, and let's just leave it at that and take it very, very naturally. So let's not get very stressed. Our psychiatrist has tuned in, so let's relax, breathe in, breathe out as we count down, and we shall start soon in another 2 minutes. So again, if you'd like to leave your video screens on, your photos, your pictures, your backdrop, that's fine, but kindly mute your mics. Yes. So having said that, thanks again for joining us. On behalf of the team at Yayasan Health on World, we are very, very glad to host. This is our first live session for 2021, and we've brought on a topic that many of you have asked us to share or to highlight. And obviously, we all know this is a hot topic today with COVID-19, and everyone's talking about figures. Yesterday, we hit another 4,000 over figures. Would you like to know what's happening in UK? We'll hear it in a while. Okay, but having said that, the questions are pertinent to what we're going through, and I think Dr. Amer's got like a whole set of questions. I will remind you that Dr. Ganesh will have to leave midway. So please do not wait and pose his questions at the end of the show, or probably the last 20 minutes or so. You can drop your questions into the chat box. Kindly do not DM me, or kindly do not private chat me, as the host has warned, because it happens quite often that people like to leave private messages and I'm not able to get them. So kindly put it into the chat, and we are more than happy. And we also have friends who are joining us on Facebook. Okay, so as soon as I get the cue, we'll start. But again, thank you for joining us today. It's I think it's 3. Since our 2 speakers are already on, the most important people are here. Obviously, I'm going to respect your time, and I'm going to kickstart this one off. So hi everyone, once again, on behalf of the team at Yayasan Health on World, this is Aliyah wishing you a very good afternoon, a Thursday afternoon. It's our significant Thursday. This is the first live show that we are having in 2021 with a very, very important, pertinent, and up-to-date topic, which is the fear of addressing COVID-19. Okay, so I would also like to say hello to our friends who have tuned in from Singapore. We have from Singapore, from UAE, from India, and also from Nepal. And of course, we have both our speakers who are already in with us. We have, kicking off first will be Dr. Ganesh Vythilingam, who is currently on a 7 o'clock time zone, sipping his coffee away. And he's going to spend the first half an hour talking to us, and after that he has to leave. So humble apologies on his behalf. But Dr. Ganesh, I thank you very much on behalf of all of us back home here, to say thank you for coming on board, and thank you for addressing some of the issues and questions that we have lined up for you. And of course, taking on the second half is none other than Yayasan Health on World's good friend and our psychiatrist, Dr. Amer Siddiq, who's also already tuned in and ready for his questions. Anything that I say to Dr. Amer, he says, okay, no problem, I okay je, boleh jalan. So guys, you can ask any questions, and Dr. Amer, I'm sure, will say, okay, jalan. But before that, I would like to thank everybody. And my last reminder, please leave your videos on. It's fine with us, but just put your mics off. Okay, having said that, Dr. Ganesh, we can't really see you, but I have to tell you this. The past 2-3 days, ever since we've posted the poster up with your face on it, I must tell you the number of comments that I've been getting, and I'd like to make your day and your morning by telling you that many have commented that you have such beautiful eyes. So I can see lots of smiles. Dr. Amer dah pening. Okay, Aliyah started off by giving a compliment. So Dr. Ganesh, that's your compliment. Would you like to say something? And I will kickstart this off now that I've got you smiling. Okay?
Thank you so much for the compliment, Aliyah. Good afternoon and good morning here from London. I hope everybody is well in Kuala Lumpur or wherever you all are from.
Yeah, cool, Dr. Ganesh. All right, let's kickstart straight into this so that we won't waste, so much of time. Okay, the first question, Dr. Ganesh, a little bit about yourself and also what's happening, in UK or in London specifically. You were with UMMC, if I'm not mistaken, and you're a peds surgeon. You're a pediatric surgeon.
Yes, I am.
Okay, so you're a pediatric surgeon. You were with UMMC during the COVID in March 19, when it first hit Malaysia. You were still in Malaysia. And you were with UMMC, and if I'm not mistaken, you were pioneering some sort of study or putting systems into place on ensuring that surgeries continued with UMMC. Am I right in saying that?
Yes. So when the COVID pandemic hit Malaysia in March and April, I was part of the team working with in the department, and we were trying to ensure the fact that we could continue providing safe surgery to our patients. So a lot of things we did not know at that time, and a lot of things we had to learn as we went along, and basically a lot of it was putting in standard operating procedures. So that was what we were doing sometime between March and April, and we could provide essential surgery to our patients who required urgent surgeries during that period of time, and then we kickstart back to normal elective surgeries after things were a bit better.
Okay, and you left for London somewhere in September.
Yep, so somewhere in September, when things were a bit better in Kuala Lumpur and everything was even better, somewhat appeared to seem better even in London, I came over here to work in Great Ormond Street Children's Hospital. I was doing a fellowship here in pediatric urology. So in September, things appeared to look good.
Yes. So what's happening in London now? I'm sure you are up to date with what's happening in Malaysia, but what's happening in London now? What do you see very glaring when you compare, since you are here and, in Malaysia, and then you are aware of all the statistics and the sudden surge in numbers, the sudden spike in numbers, and then you are in London, and is it true that people are not following and the numbers are, horrendous numbers that you're getting in London, and people are not following SOPs, and you're having this lockdown, and, tell us a little bit of truth, because there's so much of question marks that's happening when we read social media.
So what I can actually say is the fact that when lockdown was instituted in Kuala Lumpur, I'm talking about March, April and May, things were really strict. We were made to follow rules, obviously with the police, roadblocks and everything in place. Got here in September, and the feeling was that in the UK, things were not so stringent. People were still traveling. People went out to the park, pubs. What was considered the tier system here was not in force really. And September, when I came here, things were pretty good. By the time things came about in October, we'd instituted what we call the tier system back again with the hope that we could have Christmas. So they brought the tier system and they said, well, you know, we do this so we could have Christmas, everybody follow rules. But, you know, things were still, didn't seem like it was that serious. But unfortunately now the lockdown is really in place. The police do come around. They check if you're walking in groups of people. They do summon individuals if you're not from the same household or friends going out having a coffee. They are very strict on that matter. So actually right now in the UK, London, things are very, very strict, and that's because we have a large number of patients falling ill. Our ICUs are maximum capacity, and there is a general, the fear is there now. I mean, really, there is.
What kind of numbers do you see on a daily basis in a range?
I mean, in a range, if you take the population in the UK, I mean, if you compare it, we're looking at about 3,847. That's what from the UK government website is a day. But in London per se, we're looking at 1 in 20 and 1 in 30 individuals getting infected with COVID. In my team, I can give you a very personal account, you know, in my team alone, I've had about 3 of my colleagues down with COVID. One of my colleagues is still down with COVID, so he's not been able to work. And that's actually, you know, making the rest of us in the team. So we are not a COVID, we're not focusing on COVID. Our job is pediatric urology, but we are stretched. For us to provide service to our patients, we are stretched. And that's actually affecting very close to home within the team.
Right. So we see. So it is true that, you know, it is what the picture that they painted out there, that, you know, compared to 2 months ago, UK is having a lockdown, and, you know, things are getting worse, not just in Malaysia, but, you know, as well as in UK as well. Doc, I have a question, and this deals direct, you know, it's up your alley actually. You're a peds surgeon, and what I was having this conversation with a few people, and it triggered this this question was, if you look at the numbers of children landing with COVID, or children diagnosed with COVID-19, or even fatal, right? The numbers are very small or minute. Yet you find that all hospitals are saying, do not bring kids. Kids below 12 are not supposed to go out. You know, so a little bit of contradicting there. How prone are kids to COVID-19, or rather, how safe are kids with COVID-19? This includes, you know, children, young adults, maybe, you know, even the teenagers. Your thoughts on this?
I mean, basically, if you look at the literature, I mean, I was also trying to make sure that I was, you know, trying to see what's out there, because information with regards to COVID-19 is so dynamic. A lot of times people think that we as medical professionals have all the answers, and I'll be very honest, we are learning every day, and things are new for us every day with this pandemic. But essentially with children in the pediatric population, it appears that the fact that they do not mount a severe immune response. The thing with COVID-19, it is your body reacting to the virus. And with an adult population, it appears that the COVID-19 triggers a more severe immune response. And they say that the postulation is the fact that 2 factors. One is the fact that in children, the immaturity of the immune system makes it does not respond so severely. And secondly, because of the adult population is far more exposed to multiple carcinogens or inflammatory, you know, pollutants, and therefore we have already triggered our immune system. So on the whole, pediatric population, even when I was in Malaysia, because though I'm a pediatric surgeon, we did have, you know, we shared the pediatric wards. We never saw that many patients presenting to us with COVID-19. And the thing with Great Ormond Street Children's Hospital, we are specifically a children's hospital. And the thing is, what we are doing here is actually we are helping other hospitals because their wards have been taken over by adult patients. So children, as I say, don't mount a severe response to it. But the problem lies in the fact is they can spread it very well. And that's the issue why they do not want children moving around too much. You don't want them spreading to a grandparent, a parent, or any one of our elderly population because they have it mild. But if you spread it to somebody else who does not have the same immune response, therefore, then these patients will get admitted. And that's the
Right.
rationale.
Ah, okay. Is it a myth that people say children would put the kid out and get some get some sunlight and I think or our sunshine? I've been hearing that quite a bit, especially when we first had COVID. Everyone said you should stand under the sun. People said take vitamin C. Is that myth or is there some truth behind this?
I mean, like the information and the data is not there yet. Officially, if you look from a very scientific point of view, you need to have sufficient number or population of sample size. You've got to look based on the sample size. However, anything that's anecdotal, eat well, drink well, live well. I think if you take that mantra, that's all we can do. I mean, that's the reality of it. And until we get more information, more specific information, yep, breathe in good air, you know, eat well, drink well, take vitamin C and do that. Drink water. That's also good advice. You know, it doesn't protect you completely, but it's good. Healthy advice. That's it.
Stay at home.
Exactly.
Stay at home, keep your kids indoors. Because there's been quite a number of questions that we've been getting with dealing with children. Of course, these questions land on both your plate as well as Dr. Amer's plate. On your plate, the question that has landed is actually how do you keep these kids? You can't bring them out, you can't expose them. You really don't know whether these kids will, pick up or what is the rate if you're talking about kids picking up? I mean, what are the chances that, with an adult and a kid and if the adult gets it, that the kid will get? Because yesterday, a friend of mine wrote on our social media or rather on LinkedIn to say that a 3-month-old baby was diagnosed with COVID positive here in Malaysia. So, so there is I would, let's put it this way, there are chances are quite high that the kid can be
I mean,
getting COVID positive, isn't it?
No, there is. So, I mean, you have to look at it as the two different entities. When we say we are COVID positive, therefore, we mean the fact that you have the SARS coronavirus 2 in your system.
Right.
But the question is, does the SARS coronavirus 2 give you very severe symptoms to therefore state the fact that you have the COVID disease? And in the pediatric population, there's a specific entity called pediatric inflammatory multi-system syndrome. And in those population of kids, they mount a very severe inflammatory response. They end up in our ICUs. I've seen a couple of them where they're referred because of a urological problem to us. Those children require support in the sense of inotropic support and proper intensive care. But that's roughly less than 2% of the total number of population of patients. So you can't state that children have a different infectivity rate. It's probably similar. It doesn't matter the age. I've had babies, newborn babies who've come out COVID positive. I've got patients on chemotherapy, who were COVID positive, meaning they had the virus, but they were asymptomatic. We ended up doing surgery for the children and they recovered. So, it's you need to just take as your advice that you said just now. You don't take children out to unnecessary. I mean, if you look at it, our grandparents probably gave us the same advice. You don't take children to the shopping mall or take them to places. But unfortunately, I've seen newborn babies even before COVID pandemic in Mega Mall. I mean, seriously, you're not supposed to take babies outside if there's no reason for it.
Right. Speaking of asymptomatic, right? How do you know if someone is asymptomatic?
That's the problem, because they're asymptomatic. They cannot mount a specific, there is no sign. I mean, obviously, the main questions will be, do you have a fever, a headache, a cough, anosmia, that means loss of smell, a sore throat, tummy pain. So everything is very vague. Even symptoms here that we talk about is we ask colleagues, do you feel tired? That's another symptom. I mean, so it's very difficult. Each one of us have a different how would you say, method of coping with exhaustion or sickness. So I think, like I said, the best advice I could give to parents with kids is, if you don't need to take them out, don't need to take them to public places, And the thing with children is they like touching and putting things in their mouth, in their nose. They learn like that. That's part of development. But in this period of time, that is unfortunately relatively dangerous. So keep them in a safe zone. That's all I can say.
Right. And, there's another question that's been, even in my mind, I'm not sure. I keep telling based on what doctor friends say to me, but let's hear it from you. There are people who say that the virus is in you for 11 days, and some say after 5 days, some say after 7 days. What happens? Like, for example, now there's a lot of fear going on, amongst Malaysians, regardless whether they are kids or adults or even the elderly, right? So the slightest of things people take and say, I'm having a fever, do you think I'm, COVID positive? I am, no, a little bit of sore throat, do you think I have, COVID positive? And then there is some people who say, oh, wait till 5 days. Some people say, no, it's after a week, then you will get signs and symptoms. So if you're suddenly getting all these symptoms, it's a normal flu. Like, can you just give us basic advice on what do you look out for now that we are in the midst of this pandemic?
I mean, I think it is every symptom. If you have a bit of fever and a cough, the assumption it is COVID, you are having COVID until proven otherwise. And the reason behind it, and I think in Malaysia, sometime in March, April, May, we were taken it differently. Anybody who was COVID positive was shipped and put into the hospital. In the UK, it's different. If you are COVID positive, you rest at home. So my friends who are unfortunately unwell now with COVID are actually resting at home. One of my dear good friends is he's alone here. So he messages me and tells me, Ganesh, I need some food. I buy it for him and leave it outside his door because he's got nowhere else to go and he lives in his room by himself. So essentially, doesn't mean you get COVID positive. You're going to end up in hospital. You're not going to, it's looking at dengue. I think a very simple analogy would to compare it to somewhat similar to how we treated dengue. Now, right. If you look at the dengue in Malaysia, there are patients, and you know of that, who have succumbed to dengue hemorrhagic fever. The rest of them, we used to monitor as an outpatient, come and take your blood, you go back home and rest. So right now, if you have any symptom, assume yourself to have COVID, self-isolate yourself. Generally, the period of 10 days is what they're using now in the UK. And try to avoid contact with anybody else. Wear a face mask if you're in the house, you have other parents, constant washing of hands. And that's it. I mean, if you think you have symptoms, you feel a little more unwell, present yourself to the hospital, and then they will do the swab, and then they go and diagnose you. But assume yourself to be positive at this period of time, or the fact that you're COVID, even though you just think, well, maybe I'm just having a light headache or a cough.
Okay. So it's better safe than sorry then.
Exactly. That's what I'm going to be stressing on.
Doc, there is a question from Ezwan saying, Dr. Ganesh, how true is that the COVID has actually mutated into a new variant at a much faster pace, and the winter and the cold weather actually made it worse, hence the sudden spike of cases in Europe? Is it also true that the new variant is making the already identified vaccines less effective?
Well, thanks for the question, Izwan. With regards to the fact that winter and cold weather, I think they did anticipate that we do have this thing, the flu and the winter flu in Europe, and we were anticipating the fact that you'd have more patients coming in with flu-like symptoms or even COVID-19. Now, with regards to the mutation, now every virus mutates. We were anticipating this virus to mutate. Now, this mutation, is it correlated with the change in climate? The literature is not out on that yet. With regards to whether this mutation makes the vaccine less effective, again, what we have read and what is stated by the vaccine producers is the fact that it doesn't. And therefore, even the efficacy of the vaccine, we only know the efficacy of vaccine based on the data provided by the pharmaceutical companies. But that's a small sample size. So we can't comment yet. We need to see what happens. We need to see how 2021 fares out. We need to see after mass vaccination, whether we do get the appropriate response they want to have. So it's just out there.
Okay. Doc, are these, can I take it that the signs and symptoms of COVID for a kid and adult are the same?
Yes, they are the same. They are similar signs and symptoms. Obviously, in little babies and slightly younger children, it's a bit difficult to pick it up because obviously the only thing the mom and dad will say is the child is a little more irritable. And I think if the child is irritable, I mean, obviously you still have to rule out other things. It's not like every baby that comes in because of irritability, we think it's COVID-19. Babies do get urinary tract infection. Meningitis is still a common problem in some very young children. So you still, if your child is unwell, you need to see a doctor. You need to get professional healthcare advice. I mean, and that is not asking your neighbor or your friend on Facebook. So that's my, if any good advice I can give you is please check with a professional healthcare.
There are too many Dr. Googles nowadays.
Yes.
Yes, yes. So if there was something that you could leave everyone with regards to, what's happening with COVID, of course, when it comes to, the fear for your kids, the fear and, for oneself. I mean, what would be, if they could take something away from you before, you go off, something that they say, this has been endorsed by Dr. Ganesh, and I think it's really good. I must remember this. What would that be? What one advice?
I mean, the only advice I can give is the fact that until things are settled, I guess, follow the SOP guidelines. And the SOP guidelines is what our grandmother told us. Stay at home, wash your hands, eat healthy, drink lots of water. If you don't need to go and visit somebody, you don't need to go and visit somebody. Until things get a bit better, just stick to that and, be positive. And that's it. I mean, if you're feeling unwell, get help. That's it. Go and have somebody, go and see a healthcare professional and get professional help.
Doc, there's one question that just popped up for you. This is regards to, I like the question because I'm into it as well. And people are going a little bit overboard or berserk with exercise, saying that, the more you exercise or if you exercise, you actually become fitter and you can ward off the virus, obviously in a better formula. What have you got to say about that one?
Well, I guess, it depends how you take on it. I mean, it doesn't mean that you won't get the virus. So the friend of mine who did get COVID virus was a pretty good runner. She could do 5 kilometers in 20 minutes. So she's fit, but she did get the virus. But the difference is that, and what I gather with all my friends at work who did get COVID, is the recovery phase after this. It's a real whack in the system. Even 1 month post-COVID, they still feel tired. 2 months post-COVID, they still feel exhausted. So the thing is, if you are fit and you are strong, it is just that it helps you with your recovery. It doesn't mean you're protected from getting the virus. It just means that when you at least have some reserve to help yourself recover better. So keep fit. I mean, like I said, the advice you're giving, fitness, eating well, sleeping well, is general advice that we should always do. No pandemic. I think essentially we have to remind ourselves that this is advice that we need to do throughout the year, 2022, 2023, and not forget it.
Right.
Because and we never know when.
Yeah, this is not going to end very soon, is it?
COVID-19, COVID-20, COVID-21, we don't know. We should practice good advice and good lifestyle as long as we're around.
Now, I have a catch-22 situation here and a question, pertaining to that. The question is, in the event that, there's a family of 4 parents and 2 kids, and there's only two vaccines there, who do you give this vaccine to, parents or the kids?
At the moment, the priority still goes to the older population and the high-risk population. So it defines high-risk population. If you do have a child who has an underlying medical problem, probability you have to consider them. But even if you look at the current vaccine rollout plan in the UK, they actually started off with those in care home, the people above the age of 80, followed by the NHS healthcare workers. So we are actually second after the very elderly population. So, and actually, if you look at the rollout plan, children are really right down the rollout plan. But that's also because the data shows that they mount a very, very limited response to the virus. Therefore, they are quite well. I mean, fortunately, we're not seeing that many deaths or admissions among the pediatric population.
Okay, Doc, do you see, or rather, what kind of numbers since you've been there? Like now it's about, what, 3 months that you've been there, 4 months that you've been there. When we talk about below 20 years of age, what kind of numbers do we see on a daily basis in UK?
Oh, I'm not really very familiar with the number. I'm so sorry, I can't actually give it to you. But overall, I mean, not only in the UK and everything, the data is that the population less than 20, a very small number of population who are actually getting themselves admitted. You see, there's a big difference between getting the virus and getting admitted because of the virus. Here, they don't admit everybody.
Okay.
So you can have COVID-19, but you may not be admitted or you may not end up in ICU. The older population, unfortunately, ends up in ICU, or they are the ones who actually end up, being the mortality. So the under 20s are always, even though they're infected, present mild symptoms. After 2 weeks, they're well and they're back to their normal system. So again, I stress the fact that we need to be very careful with, if we have a child who has very bad asthma, cardiac malformation, or something that they are under, specialist care, you really need to be even more cautious with them.
Right, because a little bit more vulnerable than the normal healthy.
Exactly.
Right. Okay. I know we need to let you go. So on behalf of everyone, thank you so much for taking your time this morning, very early, 7 o'clock. Now it's about 7:30, I think, in London. And we thank you so much for all the very quick answers to all your questions. I am so sorry I caught you yesterday while you're trying to do surgery. But
no worries.
My sincere thanks on behalf of everyone at Yayasan Health on World, or the Health on World Foundation, and also on behalf of everyone who's tuned in. It was very informative. For everyone out there, your kids, please keep them at home. You now understand why, even though their immune may be a little bit more stronger, they have a stronger immunity system, does not mean that they will not fall or succumb to COVID-19. So thank you, Dr. Ganesh, and you have a good day. And yes, please be reminded that you have beautiful eyes.
Thank you so much. Take care, everybody. Bye-bye. Bye-bye. Thanks. Bye-bye. Bye.
Okay, that was Dr. Ganesh with us, and we'll get ready to bring on our next speaker. He has glasses, so you may not be able to see his eyes, but I'll tell you, breathe in, breathe out, get ready, because Dr. Amer is, in Malay, we say very salamber, cool and calm. So everybody, breathe in, breathe out, stretch. Let's get ready. Let's get ready to roll. Dr. Amer, hi, are you on board?
Yes, I am. Can you hear me?
Oh, yeah, sure. I can see you. Nice pictures at the back, Dr. Amer. A painter, an artist, or is that a building? What's behind?
So I'm currently in the University of Malaya. So these are all vintage photos of the university many years ago.
Cool. Okay, so to everyone out there, Dr. Amer is a psychiatrist, and he is also a clinician, because you do see patients and you run clinics. I know yesterday was your clinic day. To everyone who's thinking how I know, no, I did not go to his clinic, neither am I his patient. He told me so. Okay, don't worry, I'm fine. All right, but Dr. Amer is agreed, and Dr. Amer, you've got so many questions. Gosh, but the basic question that I'd like to ask, firstly, Dr. Amer, you are in UM, and how long have you been there?
So I've been in University of Malaya since 2005. So I've been a psychiatrist for now a decade already, about 12 years now in total. And we've been involved with COVID, well, the same time as you have.
Right, I'm sure. Doc, I would like to ask a very basic question that I'm dying to know. Do you actually see a spike in the number of cases recently, ever since you have, like COVID? Do you see a spike in the number of cases?
Yes, I've seen definitely a number of a spike in cases, and I think I break it down into the first MCO, the second phase, and also probably the second MCO that we're going through at the moment. So at the very beginning, we saw people who were probably borderline having a mental health issue coming forward. The patients themselves who were already diagnosed with a mental health issue actually came a little bit later when the MCO had actually lifted around May. But subsequently, as a result of probably the prolonged pandemic, we were seeing more normal individuals that never had a history of having mental health issues come forward around the last quarter of last year. That was somewhere around November, December. And at the moment, we are seeing that same group following through with this present MCO. Going back to Ganesh's population in children, we saw them coming forward somewhere around the Q3, around August, September, and most of them were having trouble with schooling. So one of the concerns that we've seen during this prolonged MCO is that children are having difficulties in continuing a natural, normal education. I think there is a lot of benefits in what we're doing right now in online, but there are lots of gaps as well. And we know from studies and from reports from relevant NGOs tackling these individuals that there is a population out there, a number of children that have not been able to go to school since the first MCO in 2020 March. So I suspect that we will be seeing a mental health spike among these populations moving forward because of the missed opportunities that they would have in life.
Wow. Okay. That's a lot of info, which is so good because it answers like 30% of all the questions. Doc, when you say you're a psychiatrist and you're talking about people who come to see you, regardless whether they are children or adults, and you're saying they come to see you, do you actually see, you don't actually just see patients with mental issues. You are a psychiatrist for basically anyone who has some issues and problems who thinks they need a psychiatrist, or they're referred to you for various other problems and issues as well. Am I right?
Yeah, so I think just to share with colleagues here who might not be familiar with the mental health services out there that we have in the country, often the one that is in a way the custodian or often talked about as the guardian of mental illness are normally the medical doctors with input on mental health, and they're normally called psychiatrists. However, we also have within our population a group called clinical psychologists who are often able to at least diagnose individuals that are struggling with certain mental illnesses. They are also able to do certain assessments. Around that population as well of mental health care providers, there's also a group called counselors, and often they will deal with mental health issues such as sleep, for example, maybe depressed mood, but not moving towards a mental illness per se. And then, of course, below that, we might have people like the psychiatric nurses. We might have also occupational therapists, social worker, who are also involved in mental health care. So what I do as a psychiatrist is, first of all, I'm a medical doctor, and then I've specialized in mental health. So the population of doctors who specialize in mental health are called psychiatrists. So I will often deal with people that are struggling with mental illness. So an illness is a condition whereby maybe the symptoms have been prolonged. They are starting to cause disabling situations in terms of the functioning of these individuals, so that they're unable to work, unable to act as member of society, unable to be part of, say, families because of the condition or the symptoms that they're having. So these individuals will often might have been seen by the counselors, the clinical psychologists, but because they can't be helped at that point of time, they will be then sent to us at the tertiary level care to psychiatrists. And those are the populations that I will mainly be dealing with. However, as Ganesh has mentioned as well, during this COVID situation, we see a lot more cases of many types of conditions coming forward. And if you're talking about child psychiatrists, I said just now that there was a spike at one point of children coming forward. In fact, there was one point that my ward, I think, had an average age of about probably 18, which means that there were a lot of young people in the wards for a period of time, for about a month and a half, because of safety issues, i.e. suicidal behavior, possibly, that they were needing further intervention. Now, at that point of time, we only have probably a handful of psychiatrists, child psychiatrists. So all general psychiatrists like myself, who have at least some information and knowledge on dealing with this population, will then have to basically assist in trying to tackle the number of people that are coming forward. But like I said, we are not working in silo. If we feel that the case is not as severe as it is, we can then refer these patients to our friends who are clinical psychologists or counselors to be able to handle cases that we feel doesn't require the level of care that we might be able to provide.
Right. Okay. So at least we get a little bit of background on what you do and a little bit more understanding about the cases, the type of cases that you see. Doc, let's break this down. It's not rocket science of what's happening and what people are going through, right? So you hear this word, and even our topic today is on fear. So there are lots of people who are very fearful out there, and there's lots of anxiety. In fact, Dr. Ganesh has left a question for you. And the question for you is actually, how do you emotionally, the emotional well-being, how do you deal with this emotional well-being day in, day out, looking at the numbers, the figures, what's happening around you? So that question came from Dr. Ganesh, but in line with that question, there was also another question of how do you address these fears? What do you do? Are there any techniques, anything that you can pull out your hat, like wave a magic wand and tell us, do you have some techniques that we could use to cope with this fear and anxiety?
Okay, I think first let's just share a little bit about the data. Yeah, so we did a study last year around April, looking at mental health issues that are relevant during the pandemic. And what we found was that a number of Malaysians, in fact, most Malaysians were struggling with stress, with anxiety, and with depression. Now, we also did another study in the university, particularly looking at the healthcare workers, and we found similar results, but also there was an increase of people complaining about problems with sleep. Now, these numbers are not, what do you call this? It's not, it was just not found in Malaysia. We've also seen the same reports being reported in the UK and also in China, as you know, where this problem first was introduced, or at least not introduced, was first found out or reported in earnest. So we saw that a number of people, because of the pandemic, were struggling with stress, anxiety, depression, and also sleep disturbances. Now, if you recall, when we were dealing with this pandemic as early as March and April, there was a lot more anxiety that we are having right now. Why do I say that? It's because, as Ganesh had mentioned, in March, when you asked people to stay at home because it was safe for them, they stayed at home. But now, in this particular second MCO phase, when we ask people to stay at home, we're not getting the same response as we had before. So I think one, of course, is fatigue. Most of us are what we call pandemic fatigue by now. Second is probably because of economical pressures. And we've seen that as well in the first MCO, where people brave the fact that there was very little information at that point because they really needed to put food on the table for their families. But I think the third one is because the anxiety is not as it was as before. What we're feeling, what we are having right now, however, is the prolonged stress that we've had since probably last year that is moving until now. And I think most people are able to cope a little bit better now compared to before. So what are the tips that we could give to people that probably some of you have already started doing when we were announced the second MCO? I definitely have been doing it quite routinely. So first of all is to have a routine. So if you remember the first MCO, most of us were having a lot of anxiety or fear because we didn't know what to expect. But I think this particular episode in January, we have a little bit more experience. So some of us have actually started going into routines. I know most of my patients have already started a routine because they knew that it worked the first time. And stress and anxiety is often propagated when there's a lot of uncertainty. Routines provide certainty, right? Routines provide certainty. The second one that is often used to assist people during this period of mood changes is going to be sleep. Now, I often joke about this, and probably it might be true for some of you here. In the first MCO, most of us thought it was an early holiday, because I think the school holidays was at that time. I think there was a celebration that was coming through. They thought it was like early Hari Raya or something, you know. So there was a lot of people that were spending a lot of time watching K-drama during that period of time. And as a result of that, you are having a lack of sleep, because of course, most of us were then introduced to a new concept, which was something called working from home.
Right.
Again, now we are 2021, working from home is not a new concept. It is
Right.
something that is probably now quite natural for most of us. And we've also noticed that as we had the last time, that most of us are also starting to prioritize sleep. So sleep and prioritizing sleep is going to be the second tip that you would like to take on board to assist in improving your mental health during this period. Now, the third one, which was also found during the pandemic, the first MCO, which again people have taken on board. If you've not taken on board, you really need to put this across, is to start doing some level of exercise. I know you were talking about a routine on exercise, because people found that to be very helpful during the first phase of the MCO last year. So that's why I think this year they've been a little bit more smarter in allowing at least people to be able to walk in pairs or cycle alone, with, of course, adequate distance, because we know that exercise helps in improving mental health, apart from, as Ganesh had mentioned just now, improving the physical well-being and immunity to assist in battling some of the symptoms that might actually be present with regards to COVID. So these, I think, are the three main tips that I would probably provide for everyone that you can do quite easily. First, have a routine. Second, make sure that you sleep well. And third, make sure that you do some level of exercise.
Okay, so there you go, people. A lot of you asked that question on what do you do? What can you do? How do you overcome this? In fact, Doc, someone asked the question, can you actually cure anxiety?
I think you can manage it better. I don't think there's a cure. So again, anxiety itself is just a symptom. It is the symptom where you will have both physical, emotional changes as a result of uncertainty mainly. Some of it is going to be provoked, i.e. that something causes you to have that anxiety feeling. Some anxieties are unprovoked. They just happen out of the blue. The ones that happen out of the blue are the ones that are often more debilitating than the ones that are provoked, because the ones that are provoked you can avoid. Yeah. Now, anxiety, as we know, have both physical and also psychological symptoms. There are many tips that we can actually do to manage the physical and psychological symptoms that you might manifest. The feeling of anxiety, the feeling of fear, the feeling of distress, that's the psychological aspect. The palpitations, the heart beating faster, the sweating, the feeling faint, the butterflies in the stomach. Those are the physical symptoms of anxiety that one gets. Again, anxiety as a symptom is normal. We want it, we need it, it protects us. But when you have it excessively to the point that you're not able to function or it's affecting your functioning, that's when it becomes a little bit problematic. For those individuals, there are tips that we can actually do in terms of, for example, relaxation skills and techniques which might be able to control some level of the physical symptoms of anxiety. And then you probably might have heard of talking therapies, which might help a little bit with the thinking part of anxiety, the psychological aspects. Anxiety can be managed to a certain level. And I've always believed that I think COVID-19 has actually pushed us to actually probably, I think we should be teaching our children and ourselves how to manage anxiety, at least the mild form of anxiety, because if we allow it to fester, including this topic that we're talking about, fear of COVID, for example, you might start having some disability because of it. You might not want to go out from your house. You might have trouble going back to work when we're allowed to go back to the office. I know some people are really struggling with this. During the recovery of the MCO, some bosses have asked their staff to come back, and some of them refuse to come back because they are fearful of COVID. I think we have to take note that It's probably going to be with us for quite some time. We probably need to live with COVID. So the earlier that you're able to improve the skills to manage your anxieties, probably the better. But we know that for a small population of you, you're going to struggle quite bad. And these individuals probably would require more professional assistance to help them to move forward in their life.
Doc, talking, you just, made me think of something, because you actually said something to the fact that, how do you need to be able to learn how to cope. You need to be able to learn how to manage, because obviously it's not going to go away tomorrow. It's not going to go away next week. It's not going to go away next month. We all know that. So how do you live with this, right? But when you are okay, or I'm okay, and we find that people around us, we see a little bit of signs of, withdrawal, or a little bit signs of unhappiness, a little bit signs of, some of us would say, depression, or they're not, being themselves. How or what can we do? How do we reach out? What can we do?
So I think the first thing is we have this campaign going in the Ministry of Health, which you might have or might not have heard, called the TALK campaign. Let's Stop Minda Sihat campaign. So often for, what the question that you're asking, Dato, is that I often look at TALK, T-A-L-K. So T-A-L-K has a meaning. It's an acronym for, first T, tell someone your problems. So for those of you who might be struggling, tell someone that you trust about your problem. Yeah, don't just tell anybody your problem, because there will be somebody that will membawang out there, suddenly be talking about your problem to everybody else. So tell someone that you trust your problem.
Causing you more stress.
Well, yeah, causing more stress if you tell the wrong person.
Yeah.
So the A is ask for help. I think what we realize because of COVID-19 is that it's okay to ask for help, whether you are a worker, whether you are a manager, whether you're a supervisor. It's really important for us that are struggling to ask for help early, right? Like I said, if you ask for help early, for example, if you're working in a company, you might be sent to something called the employee assisted program. You might have a bit of telecounseling that might be able to assist you. But if you ask for help too late, you'll be seeing people like myself. And of course, the amount of activities that we need to do to get you well will be definitely much more, and of course more expensive as well. So ask for help. L, for those of us who are lucky to be on the receiving end, that means we are a trusted friend or a trusted family of somebody. Listen without judgment. Yeah, listen without judgment. There's an influencer who was talking about, when someone told this person about the anxiety, that person said, basically tell yourself that you're okay. That's not listen without judgment, because you've already given judgment that the anxiety that person has provided to you was not severe, right? I think listen without judgment means that you are basically the ear that listens without any feedback that might be counterproductive to that particular conversation. Because most people, when they are asking for help, sometimes they just want an ear. And if you decide that you want to share something, ask permission to be able to share, right? So when somebody comes to you and say, I think I've got a problem, jangan terus kasih the advice, right? They might not want to hear it. But allow them to say something about their problem, and then maybe at the end you say, well, it looks like I feel you. Would you like some input on this? And if they say no, I just wanted you to hear, then that's all it was, right? But if they say, yeah, what have you got to say about it? Then you might want to give your opinion. So listen without judgment is going to be L, and K is know where to find help. So kalau the person, if you're the trusted person and you've heard the problem and you said, hey, I heard this, YHOW activity about this, and I know you need help, but you don't know where to find help, it's also counterproductive. Right. And that's why I went at the very beginning to share with you a little bit about the various mental health care providers, because once you know what they do, it's easy for you to direct people to find that help, right? Right. And again, the help could be, to me, as little as just sharing with them that you might want to see a doctor for this. You might not know what doctor, but at least you know to see a doctor. Or you might go to the level of, going online and looking for the website to the point of actually making the appointment. or to go the whole 9 yards, is to bring the person to wherever they want to go and get them registered for that particular appointment. It could be that level of help. It could be a little bit, or it could be a lot. So it really depends on how much help you want to go, but know where to find that help. Because if you don't know, you can't help, right?
Exactly.
So I
Yeah.
think
So
that's some of the the tips that I think could be useful for us to actually help people that are struggling out there.
Okay, so to everyone who probably missed it or can't recall, I've actually written it down. Dr. Amer has shared on Let's Talk Minda, which is a program initiated by the government. And the acronym TALK actually is for T, talking to someone. A is for ask, for some help. L is listen without judgment. And K is knowing where to find help. Did I get that right?
Yep.
Okay. All right. And for those of you who want the info on the last one of where to get help, just on a Saturday morning, Yayasan Health on World via our Facebook and LinkedIn posts have actually put out the entire screenshot of where you actually can get help if you do need some help, or if you need certain numbers, or where would you like to refer to in case you have some issues or problems. We actually have posted it on our LinkedIn page and our Facebook. So if you need for us to repost that, please drop us a comment, and one of my friends at 𝐻𝐻 will be very glad to do that. Okay, Doc, let's talk about work from home. You mentioned work from home. Lots of us are working from home. And a lot of people are saying that it's worse working from home for few reasons. One being that they seem to be having more work when they're working from home because meetings are consistently going one after another, on and on and on, unlike when they are in the office where they have tea breaks, lunch breaks, they can, walk here and walk there. But when they're working at home, they are like back-to-back meetings, right? So how do you actually deal with this kind of pressure? Because they keep telling, even people like me, they keep saying, I'm stressed, I'm, mentally drained, and I hate this, I don't like working from home.
First of all, it's quite entertaining when you were talking about working from home. I could see Miss Anita, Amelia all nodding. I suspect they are workers, right? And then I could see Mr. Ruben here steady because he's probably the CEO of Beyond 4. So, it really depends. I think, first of all, I use the concept of working at home before. And I think now in 2021, I think we are moving towards the true working from home. The reason why I say that is that when we were announced to be on the MCO in the 16th of March in 2020, we were all asked to literally pack our bags and go home with whatever we could. And there was an assumption that we would be back in 2 weeks. So we were working at home in the limitations that we had that was called home. We did not know that it's going to last for 12 weeks at that point. Now, during the second MCO, after for some of us being working at home from home for the last 12 months, or for some people, we are now a bit more prepared. The reason I say that is because when you're working from home, ideally, number one, you need to have certain standard operating procedures in terms of your management on what is the time to start work and what is the time to end work. Your work is the same. It's just your site has moved from the office to the home. Your 9 to 5 still stays on. So I think so for some managers out there, including myself, who manage a team of 12, we have to remember that people start work at between 8 to 4 or 9 to 5, and we should not be entertaining them or bothering them after that time because they also have other obligations to do. Now, ideally, in a working from home situation, you would have a room that you would use, or a space that would be conducive for you, and you would have protected time. You would have some discussion with your spouse or your flatmates if you're living in a flat in terms of what time to bother you and what time not to bother you. Yeah, because in the situation that we had in the MCO part 1, there was none of that, right? Number one, we were all suddenly at home. You might not have been able to prepare a space because you thought it's just going to be temporarily. The second one is that your children have also decided not to go to school because everybody is staying at home. which means that mothers are now actually becoming mothers during the time that they were supposed to be working. Spouses were becoming spouses, when in actual fact that they were, meant to be at home working during that period of time with the idea that they also had other roles. But during the period where they were working, we hoped that they were not being interfered, just as we were at work. The third one, I think, which is also important, is that we were not provided with all the equipment. I know some companies provided the equipment, more so have done so in the third and fourth quarter of last year. Of course, with the government incentive to buy certain certain items that they could claim back. But definitely, that's why I said that 2021 working from home is a little bit more natural. For example, the seat that you're sitting on, is it actually ergonomic enough for you to be sitting on there from 9 to 5 every day for 5 days for the next, say, 12 weeks? Because that's working from home. Is the computer that you have adequate to be able to get back into your work and be able to have all the information that you need? Do you have adequate internet access, for example? So these are the things that people do before they are working from home, which we might not have had when you were working at home. So I think this is the first part of it. The second one is in terms of the management side, where we also had to understand what is working from home meant. If you wanted your team to be able to provide the best level of output, you first needed the equipment that we talked about just now, but you also needed to trust them. And I think most of us, because this is something that's very new for us, had trouble with trust. I think some managers, not including myself, fortunately, need to see the subordinates under them. That's why they would call you incessantly. I know some of you ada juga yang mengangguk already, because I suspect that when you first started, they'll call you, afternoon, morning, evening. It's almost like you're trying to do the work, but they keep on calling you just to make sure that you're actually at work, not, partying outside somewhere. Yeah. So it's really important that number one, number two is for at least the management that we have that trust. Second is that we actually understand that it's a 9 to 5 and people actually have other obligations. And I think the third one that we often not talk about is actually touching base, getting people on board with you on the day's practice or the week's practice. Because sometimes it's different when you're at the office because you can actually meet them ad hoc. At home, as you know, it's a little bit tricky to get you. And these Zoom meetings also sometimes it's difficult to get engagement. So it's really important for these bosses to actually be able to engage with their teams. And I think the fourth one is also to show some level of vulnerability, because we know that this is not a natural way of working in a way for most of us. So sometimes you might be struggling, your team might be struggling. So actually showing that vulnerability and just being kind, because some people, like I said, are mothers, are fathers, are spouses. Even the single guys and girls out there also require some support. It's very hard to find a partner now looking at these computer screens. So they might be having that different level of stress too. So I think it's really important for us to be kind, and that will help quite a long way in this working at home, working from home situation that we are dealing with at this point.
Wow, that's a whole list of things, and I wish if you are a boss out there listening, or if you're the bosses on this program, please take note. If you are not, please pass this info that Dr. Amer just gave to all your bosses and say endorsed by Dr. Amer. Please make sure I got the nice chair and equipment and things like that. Doc, what about
I just wanted to say that there are companies, and I don't know, some people like Ruben probably is shrinking in his stomach now. They provided the chair to every worker. They provided these noise cancelling headphones. They provided Unify if they didn't have it, because they wanted their people to be working like in the office. But of course, the situation is different because of COVID. I mean, some people have gone to that level of care for their workers, because we know that it's really expensive to train people, and we want them to be with us and hopefully working at their best optimum capacity. But, we do know also that working at home has its challenges. So these are just small things that we try to do. Even for my university, which we didn't do all that, but the least that I tried to do was to at least touch base with each and one of them and talk about problems that they might be facing and how can we alleviate that. I'll give you a very simple example, Dato.
Please do.
Not everybody has a computer for every child.
Yes.
But, we need to have meetings with the team. So I think sometimes a bit of flexibility in terms of the time, because maybe their child needed the same computer that we're using for this particular interaction today to do their learning. So maybe during the time that the kid had the recess, then only we have the meeting with the team, because the ones that have children will probably go to the same kind of experience. Small little flexibilities like this goes a long way in actually assisting the team. Because if you imagine if the boss is so rigid, once you have the meeting exactly when the child also needs to have their teaching and learning, it causes an unnecessary amount of stress for that family, that is the person is trying to work but is unable to commit because the child also needs the same computer to actually do their learning. So I mean, small things like this might go a long way.
Yeah, I think you just need to have a little bit more empathy, not just sympathy towards this matter now, especially with I know of a certain family which has like 4 kids and 5 kids, and that means it's like having 6 laptops at home, isn't it? So it's really not easy. Ruben, there's a question whether you are hiring anybody at the moment, because everybody seems to be wanting to work with you. So please give priority to the moderator, okay?
Definitely.
Q after this. Okay, because you seem to be, I think Dr. Amer is like vouching that you're a very good boss out there. So I don't know. So guys, this is Ruben. So everybody say hi to Ruben and send in your resumes. And yeah, Dr. Amer will get lunch or something from Ruben, okay? If he so happens to hire. Now, coming back to a question, Dr. Amer, for you, is what kind, or is there a negative psychological impact on children with their parents working from home? Like, do you know of any cases, or do you see kids where they're not used to having their parents at home, like 24/7, and suddenly you find that I hear this from ladies, right? I hear this from a lot of women, like suddenly the husband is at home, the kids are at home. It's really not easy to cope. But the question from Izwan is that now that everyone's working from home, is there negative psychological impact on the kids?
Actually, in terms of the working from home, ideally it should be actually a positive impact for the children, because they will have both their parents at home with them. However, what we have seen at least is the perceived feeling of neglect, because mom and dad are at home, but all of us are on some computers system trying to get in touch with our relevant teams. So children that are at home, that seeing parents at home for the first time, both of them, most sometimes, and regularly at home, but are unable to communicate with them because they are working, right? So I think what we have found to be helpful is actually having that open communication. In fact, that is another crucial part of working from home, where you really need to have that communication about mom and dad are at home, but we are working. We will be free between say 1 to 2 for lunch, and we can have lunch together. But actually between say 8 to 12 or 8 to 1 or 9 to 1, we are actually working. So if you could, minimize the interactions because we are working. So that explanation to children, no matter how young they are, goes a long way for them to understand why mom and dad are at home, but are unable to communicate with them. And I'll give you a real true story. My brother who has a couple of children, I mean, he's been working as crazy as Ruben has been, many hours a week, a day. And then he got a picture from his son, who's about 8 years old, showing, son at the side, father on the chair with the computer. And then I think there was a bit of a dialogue, but the father was on the headphone, so didn't listen. So basically, he just went to say that the son was saying to the dad that I'm talking to you, but you're not listening. I suspect that, if there's going to be a perceived feeling of neglect, it's going to be because of that. And I think at that point, the father, my brother, was probably too engaged in his conversation, as we are right now, in order not to be able to follow the surroundings around us. Because, and I think that's probably going to be the least, probably the least amount of problems that we will have. Most of it should be quite positive, because we, at least number one, know what our children are doing for the first time. Even though you might not know what your children are doing online, but at least you know that they're physically present, they're not going anywhere at that point. Second is that there's every opportunity for you to be communicating with them if you would like to, because you're all at home. Third, if you take it positively, there's a lot of opportunities for you to build relationships with sons and daughters if you have not done yet already, because you can have, you can have time with them in the evening to play, they're present. You could do certain family activities. Lots of conversations can happen when you're doing certain things together, like watching television. I've shared with some parents, if you wanted to raise about the mental health issue that we were talking about children, when you're watching a television film together, because probably everybody is at home at this point, you're then able to say things like, wow, that was really powerful what happened in that family in the show. Sometimes I feel that way. It might be, say, about depression. Anybody here has had that same feeling. So you're opening up and allowing that conversation to start within your family, which are some positive aspects of the present situation that we're in. The negative one, as I've shared just now, is the perceived feeling of neglect, because there was no communication, and therefore people were doing their own things, and they assume their children are unable to understand. But trust me, I think kids as early as 7 years old now are very, very sharp on what's going on. It's probably better for you to share with them your feelings and your situations, so that they will understand and be more empathetic towards you and the work that you have to do.
Right. So, okay, that was a very good suggestion. So the next time you're, watching a show, those who are watching, who are online with us today, that is actually a fantastic idea to actually have some conversations with your children while you're watching the show, and indirectly that would spark a new conversation, which could be related with either mental or emotional or some sort of conversation to keep everyone alert on the current situation and how you're feeling and things like that. Doc, there is I don't know, is this a myth or what do you say when someone tells you that you must understand, I am an example, I am an extrovert, so I deal better with mental health or mental situation, or on the contrary, no, I'm an introvert, I don't know how to use even that acronym that you gave just now, talk. I don't know how to approach somebody and have a conversation. I don't see myself opening myself up to have a conversation. Your thoughts, introvert, extrovert.
Yeah, I think definitely there are some truth in these personality traits, whether you're an extrovert, ambivert, or introvert. And I think understanding this allows you to be able to work a little bit better in terms of your strengths and weaknesses. We know that for the individuals who who claim to be introverts, people who are who have difficulties in communicating with others but are still able to communicate, it's just that they like being alone, they've done really well in this isolation period. But some of us here who are extroverts and ambiverts, who get a lot of energy from crowds, from communication, we are really struggling because of the isolation that we are all involved with. However, there are solutions. Of course, they're not the most ideal solutions. We've got FaceTime, Zoom, we've got phone calls that you can make for those of us who are a little bit more outgoing out there. We've seen that these people have put a lot of energy in making videos and getting quite a lot of responses and communicating in a different platform. But these are the people, if you know your strengths and weaknesses, then you'll be able to anticipate the problems that you might be facing because of the situation that we're in, and therefore modify a little bit of the activities so that you'll still be able to be on top of your game despite the limitations that we have. People who are, like I said, people who are introverts, having problems with social anxiety, are doing really well. I had a patient who, the Malaysia would know, dia siap sujud syukur because of the MCO. Basically, he was prostrating in ecstasy because he didn't have to go for Hari Raya, didn't have to go out, meet people, didn't have to go to the shopping mall, because everybody is expected to stay at home. And then you've got the other group that are a little bit more outgoing, really struggling because of the isolation. However, the moment you introduce things like, getting online, doing these TikTok videos, or suddenly they became alive again. And sometimes it's not about just looking at the likes and the comments, but that's something that they thrive on. That really gets them going. And you can see that with artists as well, who we know that artists in general, they're pretty out there, and they do really well when you're doing all these videos, and when you tell them that all this is shut, they suddenly just, they start to have problems, right? So, knowing your personality traits and also finding ways to solve it goes a long way in actually trying to preserve your mental health during this very awkward period that we're having right now, which is the pandemic.
Yes, Doc, there's quite a lot of questions, but there's a question from Noraini that says sometimes when we want to talk to someone who we trust, just to share our fear, which I think is a healthy thing to do, but the person shuts us down with comments such as, everything, or how do you handle this? Because I think what she's trying to say is people will say everyone is in the same situation as you are. Why are you over worried? I say this sometimes, like, you can't control things that are going on. Why do you want to control things that you can't control, right? So,
well, I think first of all, like I said, it's really hard to find someone that you trust, and sometimes that's why you find a professional, because you can't find someone that you can share your problems without having to hear a comment or having to listen to a solution. That's why people actually, even though you have lots of friends, you actually find a professional that you don't even know who that person is, but you will at least be able to guarantee, number one, that person will listen to you. Number two, he or she will probably provide you advice only when necessary. And if you don't get the advice when necessary, you're probably gonna leave that person too, because you've actually acquired that person's service. So these are some of the methods that people have actually done. I've had people who come to my clinic, and I think they don't have a really big major issue, but they just don't want to also leave the sessions because they find there's a lot of value in being able to express themselves safely in the four walls without actually having the fear that it might get leaked out because of the, of course, for us, we've got the professional code of conduct that we have to adhere to. However, in saying that, to Noraini, we also have to remember that sometimes you have a trusted friend, but that person is also struggling with something. And when you're sharing something that might be quite sensitive towards that person too, that person might project their anxiety and fear back at you. So it looked like they're attacking you, but actually they're just trying to deal with whatever they're going through. So it's not to say that people are in the same boat. It just means that people react differently towards the situation, and you might just have caught that person in the wrong time of day. So again, this is where we come back to being kind, because everybody, each of us at this point of time is struggling and coping in our own way. And sometimes when we probably can see 10 people and the 11th person that comes to us, we accidentally might just blow up, right? So I think we just have to be mindful that sometimes the first time they do it, tak jadi, just forgive your friend. Tapi second time do it, then maybe that person is, probably that, not as a good friend as you thought that person was. You want to change friends at that point, correct?
Now, when people do reach out, right? Like some of us, like we get people who think that we are, how do I put it? They think that, okay, this is the person to go to, right? So they actually come to you and they actually tell you all sorts of things. And I think one confusion that I realized people were having is between how do you identify, or what's the difference between bipolar and mental issue, mental problem, mental health problem? Where do you draw that line? Like, how do you tell?
Well, this is a very technical question. So I think the first thing is that
someone asked me. I'm not good at answering, so I'm going to.
Bipolar. Just to share a little bit. Number one, bipolar is a mood disorder. Number two, bipolar is a mental illness. So mental illnesses, as I mentioned just now, mental health conditions which are often prolonged, which has a lot of disability in the individual's life, and they're unable to function in their day-to-day. So under the group of mental illnesses, there are mood disorders where bipolar comes under that. So the demarcation of whether individuals have a disorder or not is often going to be the functioning loss that they have. So if you're struggling with a mental health issue, but you don't have functioning loss, you're struggling with a mental health issue. Most people are having that problem at this point. The data before COVID was about a third of us are struggling with a mental health issue in Malaysia. But the number of people with a mental illness is very, very much smaller. And these are the people that require long-term therapy, that require medications and what have you. And if you talk about bipolar as a medical condition, only 1% of us are probably going to be affected by this condition, which means that it's a very, very small number of us compared to the population that we have at 32 million.
Right. So before we let you go, I just wanted to ask you, a lot of people are asking this question. At what point do you refer, or at what point do you tell someone who comes to you for help? Because one of the things that you said just now is allow to listen, right? And the other was for people to have that space to open up and talk to someone. So when people approach some of us, or people approach others to have a talk, or want to say something, or want them to listen, and you find, where do you draw that line to say, okay, I think you need professional help, you know, and that kind of thing? Or because I know of some people who take it a little bit too much, and I'm very, very concerned and worried that you might actually end up giving wrong advice.
Yep.
That may lead to.
So I think the first one often that I like to share with people is, number one, if you feel that their safety is compromised, right? Your friend is shares with you a conversation that sounds a lot like he's probably struggling with depressed mood. So that one you want to refer out because you're just worried about that person. The second one is probably an individual who the behavior has dramatically changed, right? A person who's quiet, who suddenly become excessively loud, a person who is starting to, you know, look like he's struggling with perceptual issues. He's starting to talk to himself. He's never done that before. That person probably requires to be referred to see somebody a bit more than just asking him whether he's okay. And I think the third group of people are the ones that are starting to struggle in their functioning, whether, you know, your son doesn't look like your son anymore. He doesn't seem to be doing anything. He looks troubled and he's not doing what sons should be doing or daughters are doing, for example. Or maybe your employee or your colleague who you can see, you know, as supervisor, you'll see the performance just zoom down. You know, you've had a chat with them, they're unable to change, they look like they're really struggling, they're looking more unkept. You know, these individuals probably require a little bit more assistance and should be referred out, because no amount of positive thinking, talking, advice definitely will be able to help them, because they are already starting to have functional loss, and that requires somebody to at least assess them and at least ensure that they are not dealing with a mental illness or any other medical illnesses or other problems that can come forward. Again, why do I say that? Because some medical conditions can mimic a mental illness. For example, a thyroid disorder might be one of them. Somebody with a brain tumor might be another one. And of course, we need to rule that out. Thirdly, people who are struggling with substance use, drug use, also, and it could not be just because he's addicted to it, it's because he's already trying to deal with his emotions or other problems using this method. And these people probably require a little bit more intervention to be able to be assisted.
Okay, one last thing before you go. I'm sure everybody would like to know this. If you could give one advice for everyone, who is going through, because in an hour and a half, we are again glued to at 6 o'clock to see, everybody just wants to know what's the number today, how many deaths, right? We're not even looking at where the clusters are anymore. We just want to look at the number. So if you could advise something to everyone, good advice, obviously, as usual, so that everyone can, like what I said to Dr. Ganesh, take that as a step mark to say, look, Dr. Amer has given me some hope, and this is what we need to do, so that we can be at least a little bit more happier during this time. What would you like to say?
Well, I think I've said quite a bit already, Dato, in terms of the tip.
Sure. There were lots of guides.
I'll give you one more tip that I think is really important, which is underappreciated. And this is about financial literacy.
Okay.
Now, I know that most of us are having a little bit more time now. Some of us are having a little bit more time. Some of us are struggling, looking for jobs, maybe are fearful of the next job. I think if you know the data, it's about 30% of us have financial literacy. 70% of us are probably very poor in our financial literacy. Now, financial health affects mental health. Financial health affects mental health. Now, for those of you who think that your financial literacy is really good, that the 30% of us, that doesn't include me, I'm the 70%, I'm financially illiterate, slowly learning. The 30% of us, how many of us are actually practicing what you know? Things like budgeting, making sure that you are spending within your means, etc., etc. Because what we've noticed is that one of the major stressors of the pandemic, apart from the isolation, the fear of contracting the disease, is the financial troubles that most of us are struggling with. And that's why there's a lot of anger, frustration, anxiety when we talk about things like moratorium, jobs available or not, etc., etc. So, if there's a good advice that I would like to give everybody here, including myself, because I'm slowly starting to learn, as I've shared with you just now, I'm the 70%, is actually to be a little bit more in tune with your financial literacy, because your financial health affects your mental health. And when you have control, again, this is about certainty. When you have control in your financial wealth, whether it is small or big, it goes a long way in at least minimizing a little bit about your anxieties and your fears. And that goes a long way in helping with your mental health in these very uncertain times.
Okay, that's brilliant advice that a lot of us have missed, but yes, it is actually very, very important. So to all our friends out there, please turn your videos on, and while you're getting your videos ready, as we would like to take a screenshot together with Dr. Amer, and of course, those of you who are still preparing your resumes, now printing for Ruben, please turn your screens on. And if I would like to sum it all up, it's you've got lots of tips, right? So from Dr. Ganesh, his morning and our afternoon, you already realized a lot on children, how they're coping, the myths, the reality that you should keep your kids indoors as much as possible. Do not expose them, and the whole works Dr. Ganesh has shared with you. And coming back to your mental and your emotional, especially your mental well-being, Dr. Amer has given lots of tips and lots of things that you can do, not just for yourself, but for your loved ones and also for your friends. And also, I think, don't forget that there are lots of places that you can reach out to, people that you can reach out to, not reach out to Membawang, he said, but reach out to the right people who will help you and provide you with some assistance, or even a lot of places which have professional help. Okay, so don't go around diagnosing that everyone needs a psychiatrist. Okay, because I know lots of you ask me, can you refer my friend to a psychiatrist? I don't think it works that way. Okay, and so no, I'm not going to give you Dr. Amer's number either. It's not going to work that way, guys. All right, so thank you so much again on behalf of everyone at Yayasan Health on World, and also thank you on behalf of everyone who has tuned in today. Dr. Amer, it was really, really good. It was a good session. So thank you everyone for all your questions. And yes, we have a final comment coming up there saying financial tips do help. So yes, to everyone out there, if you've got your videos ready, I think our back end room will soon take your pictures. So everyone with us, let's be happy and learn to live with COVID. It's not going to go away so soon. I can tell you that. And let's make the best out of every day that we have, and stay safe, everyone. Don't forget the SOPs, and don't forget, reach out and talk to someone if you need help. So can my back end please allow and tell me if we are ready? Let's take your snapshots.
Okay, in 3, 2, 1, smile.
Okay, I think we do 3 rounds because you have got more than, right? At least 2 rounds. Yep. Okay. So let's go to the second round. Okay. Once again, thank you everybody. Thank you, Dr. Amer. It was really so nice to have you and share your, your tips and the things that you wanted to say. Very practical, very simple. From a layman's point of view, you have summarized it very well for us. To everyone who's watching, on behalf of Yayasan Health on World, I thank you very, very much. Until we see you next month on our live show again, and this time it's with Dr. Sangeeta. I'm giving you the heads up so that I don't have to do this again next month. Goodbye, everybody, and thank you once again. Stay safe.
Bye, Dato.
Bye, Emilia. Bawang kita, ya.
I'm controlling myself. Okay, bye. Thank you. Good session.
Thank you, thank you. Thank you so much.
When there's a world of options at my fingertips, there are no Bye. Thank you.
Bye. Bye-bye.
It was a great session. Well moderated. Thank you.
Oh, thank you. Thank you. Thank you, Dr. Aminah, for the